are we actually killing the bugs? Or are the antibiotics making bugs more resistant? The newer and newer antibiotics, yes, they are actually making the bugs more resistant. Reports like this, resistance to everything, are not uncommon today. And WHO has already warned that our time with antibiotics is running out. Why does this happen? Because we use antibiotics. And we use antibiotics haphazardly, absolutely haphazardly. In fact, very often, we check the price list, the patient says, sabse acha, sabse mehenga dawa do. So something which costs 24 rupees is useless as compared to something which costs 4,500 rupees. There's an eye-opener of an article by Professor Abdul Ghafoor in JAPI. Title is An Obituary, Death of Antibiotics. And he says that bacteria are just mocking you, mocking our intelligence and mocking our antibiotic weaponry. And the history proves that. You see this graph where the time between introduction of antibiotic in the market to bacteria developing resistance. And here you can see it took quite some time for things like penicillin, erythromycin. But see here, linezolid, levofloxacin. The same thing here you can see, linezolid. Bacteria develop resistance in 1 year. Daptomycin, 1 year. And this, man used to think that he has conquered bacterial infections. But actually it's a major blow to our arrogance. Unfortunately, friends, the world is blaming us, the Indians, for this. This Delhi superbug is just an example of it. But there are several areas where Indians and Pakistanis or Indian subcontinent is blamed for antibiotic resistance. Basically because of no appropriate policies and indiscriminate use of antibiotics. Just to give an example of this classic Delhi superbug, we know that there are several thousands of bacteria in our guts who have been living very happily. In fact, many of them are good boys. They develop some vitamins, they protect gut membrane, and so on and so forth. They would occasionally cause infections, the healthcare related infections. But most of them have been, for centuries, susceptible to antibiotics. Now you can see there are, most of these bugs are decent bugs. They are susceptible to antibiotics. But because of indiscriminate use of antibiotics, the susceptible bugs are killed, only resistant bugs have survived. And this, once all these can pollute water supply and lead to a reservoir of very, very resistant bugs. And therefore, you can see at the bottom line, the bugs have been pan-susceptible, become resistant to penicillin, cephalosporin, resistant to piperacin, tazobactam, become carbapenem resistance, what is called a spar type of Delhi superbug, and resistant to almost everything. This is just a hierarchy of gram-negative infections, and the world is really, really concerned about it. Problem is, how do we turn the tide? Think global, but act local. How? First and foremost, accept that it's a big problem. Don't pursue the classic ostrich policy. Antibiotics should not cover up for inappropriate infection control practices. The sterilization, autoclaving is the soul of our hospital. Appropriate OT culture, appropriate work culture is very important. People give huge number of antibiotics because they say that our theater is not appropriate, unpardonable. Decrease hospital-acquired infections, appropriate hand hygiene, and a term which will be used more and more often in future, that is antimicrobial stewardship. We have been traditionally uncultured people. We must change to obtaining culture and histopathology and each and every case of infection. Most important, we must behave like surgeons. We must attack. We are famous for that. Debribe when it is necessary. As Dr. Kumta pointed out, the most important thing is appropriate debridement. If the bacterial population goes beyond 10 raised to 10, they mutate and become resistant. For example, this patient, obviously you can see she presented 3 months down the line, dislocated, infected TKR, and for almost 9 to 10 weeks, she was on number of antibiotics. She was brought in with very poor general condition with blood culture of resistant gram-negative bacteria. We knew we couldn't salvage the limb. We amputated her, but unfortunately lost her. Must remember, good old days, bugs were obedient. You could give any antibiotics, it would work. Today they defy you. They dictate which antibiotics to be used. Therefore, the Department of Microbiology and Infectious Disease will play a very, very major role in future. Why future? Today. And it is necessary that we use appropriate antibiotics. We don't use cannon to kill a mouse, and antibiotics with minimal collateral damage. Need to plan out appropriate dose, duration, and if necessary, changes. The idea is kill the microbes and don't leave them half dead. Moment you leave them half dead, they are going to govern you. Remember, there's a big difference between prophylactic antibiotics and targeted antibiotics. Prophylactic antibiotics are before microbes enter in a clean surgery. To be started half an hour prior, maximum of for 24 hours. Avoid starting them 1 day prior because they will kill the sensitive germs. Only resistant bugs will remain, but there can never be a bacterial vacuum. And within 24 hours, those resistant bugs will multiply and the incidence of infection would be high. Now, the targeted antibiotics are after infection has developed and as per antibiotic sensitivity. They have to be given for a long time and appropriate antibiotics with minimal collateral damage. We must know some basic facts about antibiotics. All higher antibiotics are not small antibiotics. They do lot of collateral damage, therefore think twice before using them. Somehow, vancomycin and linezolid have become favorites of orthopedic surgeons. Avoid using them for MSSA, that is methicillin sensitive Staphylococcus aureus. Remember, the havoc has already started. A huge, very important paper in Lancet recently, and they have concluded Klebsiella pneumoniae infection in neonatal units in New Delhi. They studied them for 3 years, and they say they are virtually untreatable. And it's in near future that there will be an era of pre-antibiotic era in Indian neonatal intensive services. Now, what is there already in neonatal unit is very, very likely to become in orthopedics. So it's a warning to all. The authorities, medical community, chemists, pharma industry, patients, do not use antibiotics haphazardly. Higher antibiotics does not mean appropriate antibiotics. And if we don't take proper measures, we don't pull up our socks. In fact, we need to pull up our trousers now. Socks is not adequate. And then, even if man develops kingopenum or gorillamycin, very, very heavy antibiotics, people will die of infection after just LSCS or radius plating. Friends, we all have to get up. Wake up. Thank you, friends.